All right, joining us live now is Dr. Isaac Bogoch, infectious diseases specialist at Toronto General Hospital. Dr. Bogoch, it's always good to see you. Hope you're well. Let's start here. There have been a lot of headlines in the last few days in the news about HIV, and we want to start with a 7th case where a stem cell transplant has left a 60-year-old man in Germany HIV-free. Obviously, this sounds remarkable from when HIV first became known to us, and it was pretty much a death sentence. So how promising is this?
Yeah, this is, first of all, it's incredible news. And as you point out, it's the 7th case of an individual who has essentially been cured of HIV. Typically, HIV is a lifelong chronic infection with fantastic drugs that can keep it under control so people live a long, healthy, happy, normal life with a normal life expectancy if you have access to the medications. But in terms of this cure, sadly, these 7 individuals had HIV and cancer. They required a stem cell transplantation for their cancer. They received a stem cell transplantation from someone who had a particular type of stem cells and genetic makeup, and that was sufficient for the individual who received the stem cells to not require HIV medications to control their HIV for years afterwards. So technically, they're cured. That's fantastic. They can't transmit the infection without taking any medication. Is this something that can be scaled at a population level? No, absolutely not. But the stem cell transplants are associated with a lot of morbidity and challenges. However, there's a lot you can learn from this in order to find better treatment tools, therapeutic tools, cure tools for HIV. So there's a lot that you can learn from these cases.
Yeah, kind of like a very promising stepping stone to what else can be done. And, you know, the key thing here is accessibility when we talk about infectious disease, and getting treatment accessible to, you know, people living with HIV around the world is certainly paramount. Now, you also recently highlighted a study out of Africa and Uganda that shows promise in a twice-yearly shot. So what can you tell us about this?
This is phenomenal. I mean, this is a big clinical trial. It was conducted in South Africa and Uganda. This was given to people who were not living with HIV, but who had risk factors for HIV, and they were living in a community where there's a higher prevalence of HIV. And if this shot was given twice a year, these people did not get HIV. Pretty phenomenal study. Now, of course, like anything else, it's very promising. The science looks good. The data looks fantastic. But the key question is, how does this work in real world settings? And if it does work in real world settings, how do you get this drug out in a sustainable way to people that would benefit from this? And that includes everybody, not just people who have means, but people who might live in a lower resource or lower income setting, to ensure that those individuals can benefit from this drug as well.
Okay, and Dr. Bogoch, let's turn to our side of the world. What about the work being done here in Canada, including, you know, the research that you've spearheaded at Toronto General Hospital? How has HIV prevention really evolved in the past 10 years? And you know, what are some of the key things that have changed?
You know, it's pretty remarkable. We're lucky enough to live in Canada, and while, of course, things aren't perfect, we are certainly doing much better than many other parts of the world. People who are living with HIV can take 1 tablet a day and live a long, healthy, happy, normal life with basically a normal life expectancy. And as long as they take that pill and suppress their virus, they won't transmit HIV to other people. That's the era we're living in right now. And in addition to that, people who are at risk for HIV but are not infected with HIV, there's medications that they can be on that effectively reduces their risk of acquiring this infection. So it's a totally new age of HIV, very different from 10, 20, 30 years ago. And we have all the tools to really reduce the rates of HIV, not just in Canada, but globally. Now the question is, do we have the political will to roll these programs out en masse? I certainly hope we do, because even without a vaccine, even without a cure, we have the tools right now to end the HIV pandemic.
Yeah, that certainly sounds like we've come a very, very long way from, you know, the late 80s, early 90s. And Dr. Bogoch, what about the work that you've been involved with specifically that you're doing?
Yeah, thanks for bringing that up. I mean, about 12 or so years ago, we started the very first HIV prevention clinic at the Toronto General Hospital, and started rolling out various HIV prevention modalities, which were new at the time. And thankfully now are widespread throughout the country. And again, myself, my colleagues, and many others around Canada are working very hard, not just to ensure people have access to HIV therapeutics and diagnostics, but also work to lower the stigma towards HIV and ensure people come forward for diagnostic testing, and also significantly roll out programs that significantly reduce the risk of HIV in people who are at risk for this infection, but are not infected just yet. We certainly have the tools to prevent infection. So myself, my colleagues at the hospital, and of course my colleagues across the country are working diligently to roll these programs out.
Mm-hmm. Well, congratulations to you and your colleagues. You're doing a huge service for people and for health here. Dr. Bogoch, I want to circle back to, you mentioned that pill that people take and they basically won't be able to transmit HIV. Does that apply to pregnant people who take the pill? If they take that pill, can they get pregnant safely and not pass it on to their offspring, or does that not work in that case?
That's a wonderful question, and it's extremely important. So absolutely, it's very important that women who are pregnant, who are positive for HIV, go on these medications because A, it's healthy for them. B, they significantly reduce the risk of transmission to their child. And we really have the tools to effectively prevent HIV transmission from person to person, be it sexually, be it from mother to child, be it through injection, sharing of needles and injection drug paraphernalia. Like, we have the tools to do this. Mm-hmm. And that includes ensuring everyone who's infected or who's positive for HIV, or people who are living with HIV, have access to medications. And also people who are at risk for HIV also have access to medications that effectively prevent infection.
Okay, wow. Sounds like so much has been done to improve people's chances of living with this awful disease. Dr. Bogoch, really appreciate your time, insight, and, of course, the work that you're constantly doing. Take care, and we'll chat again with you next week. Thank you.
Thanks so much.